Good evening and welcome to the candidate forum for the 2nd Hampshire District Democratic State Representative. My name is Peg Conniff. I'm an East Hampton City Councilor at large, as well as Director on the East Hampton Media Board of Directors. Before we get started, I just want to say some thank yous to some folks. First, I want to thank Dan Carey, John Hine, Marie McCourt. Thank you so much for being here tonight. We appreciate it. I think it's the only forum we've had in East Hampton, so I'm really excited to have you guys here. I also want to thank everybody in this room for coming out tonight. Thank you so much for being here. I want to thank those folks who are watching on television. We are also going to rebroadcast this tomorrow night at 7 o'clock on the cable. So if you know of anybody who hasn't had a chance to see it, they can see it tomorrow night. I want to also thank East Hampton Media, so I will thank myself, and you're welcome. I also want to thank East Hampton Council on Aging and the Executive Director, Brendan Rogers, who will be moderating the forum tonight. We wanted to focus specifically on the issues around the senior and aging population. And so Brendan, I would like to say that he volunteered. It's more like he was voluntold. And so he will be moderating tonight and asking all the questions. So thank you, Brendan, for being here. Just a couple of housekeeping things. We drew lots to put them in the order that they're in. Those are the way the questions will be asked, so we'll rotate every question. Someone else will start. We're going to give them 2 minutes for each question, their answer, and there will be a timer in the front row here that you guys can look at, and we'll give you like a 10-second warning if we think you need it. At the end, we'll give you 3 minutes to wrap things up. After all the questions are done, you'll have 3 minutes to speak and give any comments you like. So, without further ado, I would like to have each of the candidates provide a 2-minute introduction, and we'll start with Dan Carey.
Thank you. Thanks to the Council on Aging and to East Hampton Media for having us tonight, and thanks so much to everybody who came out. And so important you get involved and get informed. Really appreciate you being here. My name's Dan Carey. I grew up here in East Hampton, and I grew up in a house with 5 kids. I've got 4 siblings. 2 of them are older than me, and 2 of them are younger than me. And when you grow up in a house like that, you learn a lot very quickly, and not just don't be the last one to the dinner table. You learn communication skills. You learn listening skills. You learn how to collaborate, how to get along with others, how to work together towards a common goal. And those are skills I've employed throughout my life. I took them with me to college, and I used them when I had a part-time job running a after-school program in Roxbury. I used them when I came back to East Hampton, and I worked at Whitebrook Middle School. And I was a paraprofessional in a special education department. And with 5 kids at home, with an after-school program in Roxbury, Whitebrook Middle School, the kids don't always get along, and you need those skills. I used those skills when I left Whitebrook, and I managed Riff's Joint, which is a restaurant here in town. And there, the adults didn't always get along. But I still employed those same skills. I used those skills when I served a full term on the East Hampton School Committee, and I use them now as an East Hampton City Councilor, where I'm on the Finance Committee and I chair the Public Safety Committee. I also use those skills in the courtroom every day as an Assistant District Attorney. Those are all situations, City Council, in the courtroom, where the adults aren't always getting along. And you need those skills of working well with others, communicating, listening, collaborating, and working together towards a common goal, even when you don't always get along. And those are the same skills our next state representative needs to bring to Boston, where the adults don't always get along, but they need to work together to get things done for the people of East Hampton, Hadley, Granby, and South Hadley. Thank you.
John?
All right, good evening, and thanks for Brendan and Peg for hosting this. It's great to be here in East Hampton after several forums in South Hadley, so good to be here. Actually, I've been in this room several times during the course of the summer, though I never anticipated actually being up here at this point. But first, let me introduce myself. My name is John Hine. I'm from South Hadley. I've been married to my wife Karen for 36 years, and we've lived in South Hadley when we got married. We moved in. We have 2 children, both of whom went through the South Hadley public school system. Zach is 30 years old and lives in Colorado, and Melissa is 28 and is a public school teacher in South Hadley Middle School teaching 6th grade math. Professionally, I've been in information technology for over 35 years. I started at Mass Mutual, worked at Holyoke Medical Center, and for the last 20 years, I've been at Bay State Health, a very large integrated health system throughout Western Mass. So for the last 30 years, I've been working in the healthcare industry, and I've gained a thorough understanding of the challenges and pressures that we face with healthcare. My second career, if you will, has been in municipal government in South Hadley, which has been equally extensive. I have served on the school committee, so I'm very familiar with the foundation budget and the funding formula issues that we face. I've served on the planning board, where I got an in-depth look and experience with zoning bylaws and subdivision regulations. I was on the select board for 12 years, so I know municipal government really well, how it works, and also how important a state representative is to the town. And finally, I am currently on the Municipal Light Board, which has given me great opportunity to understand the wholesale electricity market. So my professional career and municipal government experience, I feel, has prepared me quite well for this next step. Thank you.
Thank you. Marie?
Thank you. Thank you to East Hampton Media and the Council on Aging for sponsoring this, and thank you to all of you for being here. My name is Marie McCourt, and I grew up in Granby and graduated from Granby Public Schools. My husband Matt and I bought my family home and raised our son Gregory there, but I think it's important to mention that my sister had a house on Elliott Street here in East Hampton from the time I was a young teen, and I spent a lot of time walking up and down Cottage Street and the whole area and enjoying the beauty of the pond. So I've been around East Hampton for a long time. I've worked, volunteered, and advocated all around the surrounding communities for the last 30 years. Since my dad died when I was 11, I've been working since I was 13 years old, whether as a janitor in the high school, working on Matt's family farm, working, taking care of patients with Alzheimer's and dementia, or taking care and running up to 15 after-school programs all over Western Mass, 3 of which currently are in East Hampton Public Schools, and I've been doing that for the last 12 years. It's fair to say that I know how to work hard, and I've always been a hard worker. I've continued to work multiple jobs while earning my degrees, serving as a volunteer in the community, serving on executive boards of nonprofit organizations, and serving as an elected official. In my campaign, I've talked a lot about education, healthcare, elder services, food insecurity, and transportation. It's because all of those things are really important to me, but they're also really important in our district. If I'm elected as your state representative, I know that it will be important to listen to the lives and struggles of the people in our towns and to take our needs and values back to Beacon Hill.
10 seconds.
On September 4th, it's primary day, and I hope you'll vote for me.
Thank you. Thank you. And now I would like to introduce Brendan Rogers, the Executive Director of the Council on Aging. Brendan will be asking the questions, and take it away, Brendan.
All right.
Hello, everyone. As Peg said, my name is Brendan Rogers, and I'm the director at the East Hampton Council on Aging. And this opportunity is really important to us. There are many pressing issues with the elder care right now, and I feel like sometimes this is overlooked during an election period. So bringing this to the forefront is an amazing opportunity. So I want to thank City Council, East Hampton Media, and of course the candidates for doing this tonight, because it really means a lot to us. So thank you. So if you guys are ready, I'll start with Dan.
Sure.
All right. In your opinion, what are the biggest issues facing our senior population today?
Thank you. There's a lot. There's a lot. From everything from assistance to healthcare assistance to housing to transportation. There's not one quick answer to that question. And the real problem comes down to money, unfortunately. But money as a means to helping solve all those problems. And we see it in town here in East Hampton when we had the override vote for the new school. And a lot of seniors got involved and came out and spoke with us on the city council about property taxes going up and what we can do to work on that. And that's something that conversation still continues, whether 41C is enough or 41C and a half, or, I think whoever the next state representative is should look at combining those and making a new 41C, because there's holes in both of those. And those are tax breaks for seniors that are eligible. But we look at the budgets coming out of Boston and how underrepresented Western Mass is, and that directly affects all those needs that I mentioned at the beginning. Just look at transportation, for example. I know our senior center has had to up transportation, and whether it's grocery shopping or doctor's appointments or whatever it is, the PVTA is cutting their routes and raising their prices, and we've got folks who rely on that transportation. And so we need fighters in Boston to bring more funding out here to help all those levels that senior citizens depend on. Thank you.
Okay.
John, go ahead.
So I've done an awful lot of door-to-door canvassing this summer throughout all 4 towns. We have a neat little app on your phone that tells you who the Democrats are, the frequent voters, and a little information, including how old these voters are. It's astounding how many people in their 70s, 80s, and even 90s are still living at home. Fortunately, they're voting. But it just gives you a sense that we have an elder population that is at home, and I'm sure they're trying to live at home as long as they can. And obviously the issue is how long they can remain independent, and at what point they're going to have to start needing assistance. I went through that with my own mother, who had 2 homes, one in South Carolina and then our family home in Wilbraham, and you could see over time the difficulty she had of keeping the house up. But stubborn, fiercely independent, she didn't care to be helped by anybody. And I'm sure that's a characteristic of many elders who have lived a long life, and they feel that they can take care of themselves. But as we grow older, as a community, we're going to see more and more people trying to stay in their homes, and we're going to have to be looking at how we can provide them assistance to stay in their homes, but to take care of some of the small things that people are no longer able to do.
Marie, when you're ready.
Thank you. So Elder Services has always been part of my platform, and that's because my mother was a nurse's aide and a personal care attendant, and I also started a career when I was about 17 working in nursing homes, and realized that it was very heartbreaking for me to see the struggles that seniors were living with. As I have worked through the senior systems and the Council on Aging's for over 20 years, what I started to see is that we have a growing senior population, but we have less money for senior lunch programs or activities at Councils on Aging. We also have less in transportation. Transportation in our district is dismal. In 2 of the towns, so Granby and at least half of South Hadley, there's no transportation, and seniors are left using dial-a-ride from PVTA, which is a very hard system, especially if the Council on Aging doesn't have a lot of vans to use. One of the biggest issues I see, though, because I work at the Neighbors Helping Neighbors Food Pantry in South Hadley, and I've learned through the Food Bank of Western Mass that seniors are the fastest growing population of starving people in our district and in our state. That's heartbreaking. So I've seen it happen. My own mother had a problem getting food stamps. She's a senior now, and we really have to find a way to support seniors even when they're not sure they need help. People might be stubborn and they might not want to ask for help. Somebody has to be their voice.
Okay. So the second question goes to John. In April 2017, the Department of Transitional Assistance launched the Healthy Incentive Program, an initiative that reimburses SNAP recipients for purchasing fresh local produce. Within 10 months of the initial launch date, the program became so popular that it exceeded its original budget and was temporarily suspended. While HIP has been included in the FY19 state budget, there is a chance that it could be level funded or face budgetary cuts in 2020. As a state representative, would you support this program? Please explain your position.
Yeah, absolutely. Access to good, healthy, locally grown food is a win-win. If we want people to stay in good health, obviously they have to eat well. So you may be spending money up front, but to the degree that people can eat well and stay healthy, you're saving money on the back end. Likewise, it provides another market for our area farms. If they can sell more product, then that's good for them. So I think this is a program that should be increased based on the demand. The only issue that we also have to look at is how do people get to the farmers markets? And is there transportation available for senior citizens or the low-income folks to be able to get to the market in order to buy those foods? So that's another issue that we have to deal with to make that program as effective as it could be.
Now the question goes to Marie.
Absolutely, I support HIP, especially being part of the food pantry and the food bank of Western Mass. It's something that we try to make sure people understand. There were a few things actually that happened last year. Not only did we run out of money, but one of the things they had trouble with was actually helping seniors and anybody understand where they could go to use the HIP program. So for instance, my mother had no idea where there was a farmer's market in Chicopee where she lives, and they didn't hand out information. So that's something that they needed to fix. However, then more people are using it, we run out of money sooner. I think one of the ways that we can fix that problem is by codifying into law the HIP program and making sure we can expand it and put more money into it. It's an amazing program. Not only does it support the people that are on SNAP, it supports farmers, it supports the whole food industry, and as well, especially because we have transportation issues, there are many food deserts in our district, and people if you think about Granby and Hadley and some parts of South Hadley especially, because they're not cities, there are places where people are living pretty far from any kind of food, especially if you're looking at grocery stores. So if they can get to a local farm stand, it's much easier for them. So we have to make sure that we expand the HIP program. We also need to make sure that the EBT machines work at all of the farm stands, and that doesn't always happen. So that's what I would work on.
Thank you. Now the question goes to Dan.
Thank you. I think the HIP program is a wonderful program, and the big problem we have with the HIP program right now is it's a wonderful program. It's so successful because so many people are using it, and it matches the SNAP dollars, dollar for dollar, and that's a good thing. That's a beautiful thing, and it's something we need to make sure isn't just level funded, but is increased, and that's something that we should be supporting. And I'm so glad you brought it up at the Senior Citizen Forum, because a lot of folks don't realize how many of our senior citizens are dealing with these types of issues. If you think there's not homeless senior citizens or food insecure senior citizens, unfortunately, there are. And I know our Council on Aging helps out with SNAP and Mass Health and Medicare and fuel assistance and housing and all these things, and we need to be supporting these types of programs. The HIP program is a total win-win, not just for the folks using it to get their healthy food, but for the farmers. And here in Hampshire County and in the 2nd Hampshire District, we're very lucky where we've got a lot of these farmers. You can look at the numbers in Hampshire County, about $89,000, a little over, is spent through the SNAP recipients, but over $100,000 is brought in through the HIP program to our local farmers. So we know people are coming from other counties to use their HIP benefits here. And we also know that senior citizens are some of those folks. In Massachusetts, 1 in 10 people is food insecure. It means they don't know where their next meal is going to come from. And 1 in 7 kids are food insecure, and 1 in 20, 1 out of every 20 senior citizens doesn't know where their next meal is going to come from. So we need to be doing more to support them and to help them.
Thank you.
Thank you.
The third question starts off with Marie. In a 2015 study, the Donahue Institute at UMass Amherst found that by 2035, nearly 29% of Massachusetts residents will be aged 60 and up. As this population continues to grow, the demand for senior services will only intensify. To successfully meet the needs of this demographic, it is important that we develop strategies now. What role would a state representative play in this process? And also, what resources might a state representative use to identify the specific needs of the elders in their district?
I think it's really important to make sure that seniors have a voice. And I think that one of the things we could do is create advocacy groups around senior centers and around any senior groups. As well, something that people have been talking to me about in the district is making mentorship programs between older people and younger people, because one of the fears of the older people I've been talking to is that the kids that are coming up in our society don't necessarily always have grandparents around, and they don't understand always the issues that seniors are going through. So unless, like me, starting at 12, working around older people because of my mom, I would not have understood all of the struggles that are happening. So it's really important for a state rep to make sure that there are good educational programs and that we're really fighting to bring back funding to our district, because as we know, the state stops at Boston, and we have to make sure that we are bringing those funds back for the seniors and for the systems that we need here to keep everybody healthy. I think that's of main importance, and creating advocacy groups is a way to do that, to make sure that we keep hearing from seniors.
Okay, now the question goes over to Dan.
Thank you. I think it's so important that reps across the state are listening to the senior citizen population, not just because it's growing, but because it's here. And so collaborating, making sure everyone's at the table, that's true of every group, not just senior citizens, but really fighting for the needs of these 4 towns. That's the job of this rep. A huge part of it, unfortunately, not to keep harping on the money, but that's something a state rep can help with. Getting money back to the district, back to the towns, back to the senior centers and councils on aging, whether that through grants and other means. But we also need to look, as this population grows and the game changes, we also need to be open to changing the rules. And one just quick example I already mentioned is that 41C and a half. And as I look at both of those, I don't love either of them. But we could take the best of each one and make something new that really can help the most amount of people. And so that's just one idea of something we can continue to look at. And that game's going to continue to change. Whether folks, just for an example, when I was a junior in high school, my grandfather passed away. And the conversation was, well, what's going to happen to grandma? Is she going to go into the nursing home? Is she going to stay at home? She's getting older. Should she be at home alone? And my family moved in to her house so that she could stay at her home for the rest of her life. And we were very lucky that we were able to do that. A lot of families aren't that lucky and are facing really tough decisions and really expensive decisions. And that's a huge part. I mean, I took an elder law course at Western New England University School of Law just on these issues. How do you help someone plan their finances and plan their retirement in case they live longer than they expect to, and they don't know what to do with their money, and they don't know where to live? These are just huge issues we need to always be considering when we make these kinds of decisions. Thank you.
I think the point people for identifying and addressing senior issues are our local senior centers. They're the ones that are in touch, have a sense of what issues our elders are dealing with. They see a lot of them every day. They provide food, they provide social opportunities, they provide various programs. So certainly, as a state representative, I'd want to be listening to Brendan on a regular basis in terms of what's happening. The senior centers will have a good finger on the pulse of what the needs are. And then it's a question of what can the state do to enhance the services that our senior centers provide. But there's also things that could be done outside of government. And you're hearing about this on the eastern part of the state. Volunteer groups where people come together and they go out to the homes of the elderly to help with very minor, simple things that are difficult when you start losing your independence, whether it's changing a light bulb or mowing the lawn, simple things that become very difficult as you get old. There are more formal groups where fees are charged to be part of the group, and it's more formalized in terms of the services that are provided. But I think we have to look at this both at a state level, certainly at a local level, because the senior centers are going to know what's happening out in the field, and then as a community. And the other thing is municipal government has to understand that the services that it provides, it has to reevaluate as we grow older as a community, what services local government should be providing as part of the overall services to the town.
All right. This next question is something that we see on a daily basis, so I find that this one, I'm really curious as to what your opinions are and your views on this issue, because it is something that hits close to home. So Medicare prescription drug coverage can be extremely difficult to manage. Oh, I'm sorry, starting with Dan.
I'm ready.
So Medicare prescription drug coverage can be extremely difficult to manage, especially for those with preferred brand name drugs or high-tier medications. Once an individual and their insurance plan have hit a cost-sharing limit of $3,750, the individual is then expected to pay 35% on brand name and 44% on generic meds. This phase is often called the coverage gap. And Medicare beneficiaries can easily spend hundreds of dollars on a 30-day supply for one medication. What legislative steps can be taken to address this issue, and how do we protect the individuals who are not eligible for prescription drug subsidies?
Thank you. Huge issue, obviously, as you mentioned, and one that affects so many people. Everybody's got health problems, and we see that so much more and more when we're talking about the senior citizen population, and we're talking about finances. And this is something, we're talking about the game changing and changing the rules. This is something we really need to look at from the ground floor and say, there's a problem here, and what are we going to do about it? There was a great article in the New York Times over last weekend about these prescription costs, and people want the name brands, and the name brands are boosting prices for no reason but for their own profit. And they know people are relying on these drugs and can't do anything about it. They need to buy them. And so there's the federal government is not helping anyone, unfortunately, right now. And so this just shows us how important local government is and state government is. And we're seeing more and more states come up with these laws where the prescription drug companies have to justify these increases, and they can't just raise the price on these prescription drugs that folks rely on. And so we need to look at more and more creative ways of making sure that people are not just getting what they need, but that they can continue to get what they need. Thank you.
And John.
So there was an article in the Republican this morning about a study that was done looking back at 2016 about prescription drugs used by Medicare patients, and the fact that Medicare patients are required to go with the brand name drugs. And if that drug usage was switched over to generic brands, Medicare would have saved almost $1 billion in 1 year. Unfortunately, and I don't know why, well, you probably do know why, but Medicare cannot negotiate drug prices with the pharmaceuticals. That was written into the law when the Part D was passed back in 2000, 2002, something like that. It's incomprehensible why we would put up with something like that. And we talk about the rising cost of healthcare. Well, there's just one item where you can save a lot of money. So we as a state have to work hard in terms of our Medicaid program, how we can negotiate lower drug prices. The other side of this is on the healthcare side. I've seen it with my mother and my mother-in-law, that oftentimes they see multiple doctors, and one doctor doesn't know what the other doctor is prescribing. And so you ask, Mom, why are you taking this drug? And she doesn't know. And you find out that you got these drugs that are just being prescribed but are not really doing anything useful or helpful for the patient. So on the healthcare side, we have to do a better job of healthcare providers seeing the medical record, seeing the entire plan of care, and understanding what medications are working, and informing the patient as to why they're taking the drugs that they are.
Marie.
I believe the first step is that we have to work with Medicare and change those laws so that they can negotiate with drug companies. One of the things that we really don't do well in this country for anybody is negotiate drug prices. We're all paying way too much. I'm a type 1 diabetic and I take insulin. I'm on a pump. And if I don't have insurance coverage, which happened to me a couple months ago when my insurance decided they were not going to cover my insulin, which is completely life-saving for me. I can't live without it. $475 a bottle for something that was created a long time ago and should be very, very inexpensive. Drug companies have us in a stranglehold, and we need to be able to fight and regulate those prices, and especially for seniors, because seniors are choosing between, do they eat, do they pay their rent, or do they buy their medications? And it's causing huge health issues. And as well, all of the care that seniors get, if they have to go into an assisted facility, their houses get taken away. It's all gone because all of those costs go into their care. We have to regulate medical and medicine costs, especially for seniors, but for everybody.
Thank you. All right. So this next question goes to John. Applying for subsidized housing can be a challenging and lengthy process for seniors. Many of the local housing authorities in this district often have a 2 to 3 year wait list, if not more. Even in cases where a senior applicant qualifies for emergency housing, there are no guarantees that a unit will be readily available. In the next several years, we anticipate the need for housing options to steadily increase. In your opinion, how can the state and local government work together to mitigate future housing issues? And then, do you believe there's a possibility of making individual rental vouchers more accessible to the senior population?
Well, I touched on that in my opening statement, that when you talk about affordable housing, and creating more of a demand, that's got to be a partnership between state and local government. Local governments, have their zoning bylaws, and it takes local governments to make changes to those bylaws. So we need to look at ways to encourage multiple use development, high density development, and incentivize the development of affordable housing units and senior housing units. So, of course, the state could do something like it did with Chapter 40B and allow developers to bypass local zoning bylaws, but I don't think anybody thinks that's the way to go. So there really should be a partnership between the state and local governments to identify ways in which zoning changes can be used to encourage and incentivize the development of affordable housing.
And then Marie.
One of the problems at the state level is that we haven't had zoning reform change in over 20 years. And the state is changing at an exponential level. So as we start seeing the senior population grow, nothing's changed at the state level. So I think the first step is that we really need to keep pushing for the zoning reform change. They've been trying to get it to pass for 20 years, and it keeps getting to a dead end and doesn't go anywhere. I think that's the first step. The second step is we already have a housing shortage in general all over the state. And so we're not making affordable housing available, whether it's for non-seniors or seniors. And we need to make sure, especially, that we're watching our seniors, because often elders are maybe stubborn, might not be a good word, but they don't want to ask for help, and sometimes until it's too late. So it's really important that we're keeping an eye out and we're looking at the changes we can make on a municipal level, on a state level, to make sure that we're protecting our people who most need it.
And Dan.
Thank you. The district attorney's office in Northampton is on, there's a big sidewalk out front with a bunch of tables and benches. There's always people hanging out there. And when I came out not too long ago, a couple weeks ago, a woman jumped out of her bench and said, "I've been waiting for you. You're from East Hampton, right?" And I said, "Yes." "I heard you're on the city council." Yes? Now I'm nervous. She said, you guys have any affordable housing over there for seniors and subsidized housing? And I'm on the Northampton list, and I'm on the Greenfield list, and I'm on the Springfield list, and I'm on all these lists, and I'm doing all the right things, and and it's an emergency, and it's a 3-year wait at best. And I had to give her the bad news. I told her who to talk to, but we've got those waits too, and it's a huge problem. It's a huge problem. And it's something that we need to get creative on. We need to collaborate, and we need to work together to increase the number of units. I was at a meeting recently with officials of all different levels, local, state, federal, talking about new developments. And would they just be market rate, or would they be affordable housing? Would they be assisted living units? And if there were, what kind of, can we help the developer make that happen? Can we make sure he comes to East Hampton? Because we want those affordable housing units. We want those assisted living units. And so it's something we need to continue to work on. And unfortunately, it's like the HIP program. The need is so big that that's where the problem is. So we need to work harder at making it available to more people, because those people who need it are out there. Thank you.
Just a quick intermission. It looks like we're gonna have some extra time, so I wanna hand out some cards to ask the audience to write down some questions, so at the end, if we have some time, we'll ask some of those questions.
Great.
All right. So the next question goes to Marie. Do you believe our current model of healthcare provides adequate coverage for seniors? If not, do you feel that the advancement of Bill S619 to establish improved Medicare for all would be a viable option? Please explain your position on this topic.
If anybody has read anything about me, and especially I wrote a column for the Gazette last week, I'm a huge proponent of single-payer Medicare for all. And I don't always think that the Medicare system as it is right now always works. I mean, as I said, my mom is a senior, and I watch what she goes through and some of the things that don't work for her, and she has to have gap insurance to cover what's not covered. But I think that if we were able to create a very good system of Medicare for all, we could cover everybody in a much better way, and it would be more equitable. Seniors are so often just left without services, and it's heartbreaking because all of their money that they've worked for all their lives goes to medical care at the end of life, and that is not okay with me. So absolutely, I support Medicare for all the way, and I think that the job that we need to do is really look at it, talk about it, plan it out, and make sure that we are creating a system that really will work for most people, hopefully all people, but that's pie in the sky thinking. So absolutely, Medicare for all I think is the way to go, and we need to make sure it covers everybody.
Dan, please.
Thank you. I support Medicare for all, or single-payer health care. There's absolutely no reason Massachusetts shouldn't be a leader on this front. We've been a leader on so many, including healthcare. There's no reason everyone shouldn't have access to affordable and excellent healthcare. And as I said earlier, it affects all of us. An example I hate to use from the district attorney's office: before I was an assistant district attorney, I was the director of the drug diversion and treatment program. And that's a program that I helped to start about 2.5 years ago, where folks were coming into the criminal justice system based on addiction issues, no long criminal history, no violent history, that kind of thing. I would work with them to help get them into drug treatment rather than prosecute them. And so sitting with these folks, I was kind of the bridge between the courtroom and the healthcare system. And my least favorite thing to ask these people was, what kind of insurance do you have? Do you have insurance? Sometimes I would hope they didn't have insurance because they might get better treatment. But I'd have two people on the same day sign up for the program, have two different types of insurance, have the same needs, the same substance use disorder, and they would go and get two completely different types of treatment, which is just a terrible state of affairs. And it doesn't just affect those folks. Although I will mention, if you think that the opioid epidemic hasn't reached senior citizens, that's not true either. A lot of folks dealing with that. But even just down to prescription costs, if that's something that's not fair, and it should be, because it's something that people need, and we should be helping them in that time of need. Thank you.
John, please.
So whether you're talking about Medicare, Medicaid, commercial insurance, every one of those has an issue, and the issue is rising costs, which impact access to care. Medicare costs are rising. Medicaid, both are taking over 40% of the federal, the state budget, and that's increasing. So we've got a big problem with rising medical care costs. Single payer, the idea that you eliminate or consolidate all the various commercial insurance, private insurances into one entity, holds promise as a possibility to address that. That's going to take a long debate across this country. Maybe we can do something in New England. I think it's a little difficult to look at one state and try and implement it at one state, but certainly that probably holds the best promise of making significant cuts in costs. However, that's going to take a long time, and we need to do things now to try and slow that rise in costs. I've already talked about prescription drugs and the fact that Medicare can't negotiate with pharmaceuticals. That's $1 billion in 1 year. Simple things like encouraging people, making it easier for people to go to urgent care centers rather than emergency rooms. Emergency rooms provide care at the highest costs. So if somebody's going in there for a fever or a rash, that's a very expensive way to treat them. There are what's called accountable care organizations, where groups of providers are given a population to manage, and they're given a set amount of money to do that with. And if they do a good job and keep their patients well, they keep the savings. If they don't, they have to pay the difference. So it incentivizes keeping people well.
Okay. This next question goes over to Dan. Many seniors in this district rely on PVTA for transportation needs, and it is considered an essential service. Unfortunately, the organization has recently increased fares and will be making service reductions on multiple routes due to a deficit in the budget. How can we maintain the services that are currently in place, or how can we improve them? Do you believe that the state should have contributed more in deficit relief funds?
Thank you. Absolutely. Absolutely. It's embarrassing. The state of public transportation in Western Massachusetts is embarrassing, and we need to fight harder in Boston on so many different topics, but especially here. The conversation in Boston right now about connecting North Station to South Station drives me crazy, and they're talking about millions and billions of dollars. And at the same time, I went to college in Boston. It might be a 1 mile walk. At the same time, we're out here, the 2nd Hampshire District, East Hampton, South Hadley, Hadley, and Granby. And if you don't have a car, you're gonna spend all week walking to work. You're not gonna get to work. You're not gonna get to the doctor's appointment unless you've got some good friends that are driving you around. We are cutting routes because we're losing funding. And then we're raising prices because less people are riding the PVTA. Well, no kidding, there's less routes. They're not going where we want them to go. Granby doesn't have a bus stop. So I think you're absolutely right that we need to fight for more funding, and we need to fight long and hard and loud. And another aspect of public transportation we need to fight long and hard and loud about is the east-west rail. And that's gonna do a lot more than just get us to Fenway Park quicker. It's gonna allow more people to live and work out in Western Massachusetts. It's gonna create jobs, putting that in and maintaining it. There's benefits across the board with that. And when we look at, as I mentioned earlier, the PVTA cuts, increase senior center and council on aging costs. And we just did the budget not too long ago where we talked about that. And our East Hampton Council on Aging is trying to increase transportation because they recognize that as a need. But it's the state letting the city down that they need to do that. Thank you.
And John.
So the regional transit authorities have been level funded for the last several years. And of course that translates really to a cut because costs keep going up. You know, where there's cost of services, personal services, materials, costs go up, you level fund, you actually then have to start reducing services to make up that difference. And then of course you reduce routes and frequencies and you start losing ridership and it becomes a death spiral. So we need to invest in our regional transit authorities. And I say regional transit authorities, there are 11 or 12 of them throughout the state outside of the Massachusetts Bay Transit Authority. So there's a lot, everybody else in the state has a regional transit authority. So we need to work with the other legislators to address this funding issue. And understanding that it's not just a matter of people getting to where they need to go, it's an economic development issue in terms of people being able to get to the jobs that are available. Likewise, businesses and companies knowing that they can attract workers and that those workers have the opportunity, a way to get to work. It's a quality of life issue in terms of, you know, reducing congestion on our highways and roads. It's an environmental issue, trying to reduce pollution. So on so many different levels, public transportation, we need to make an investment as a state in improving public transportation throughout the district, throughout the state.
And Marie.
I have so much to say about this one. I'm going to try not to talk really, really fast. So in Greenfield, the Council on Aging was part of a pilot program where they got grant money because if anybody knows about the dial-a-ride system and how it's a really fun phone tree to work through, it's pretty bad. It takes a long time. People wait a long time for rides. So Greenfield got this grant to do a pilot program where PVTA supplied vans to the Council on Aging. The Council on Aging supplied drivers who were benefited, full-time drivers, and they also supplied dispatch because they're used to already doing that. So instead of using dial-a-ride, you're talking to a real person, and you know, anybody who has any kind of processing issues or hearing problems would really rather talk to a real person than a phone tree. And so in Greenfield, instead of somebody getting dial-a-ride that actually travels all the way from Belchertown, all the way through Greenfield, and having to wait 2 hours after a doctor's appointment on December 5th when it's 5 degrees out and they have a heart problem and shouldn't be outside, in this case, they were able to use these vans that were for Greenfield and get to their appointments in a timely manner because those vans were only going in Greenfield and kind of just outside of the Greenfield service area. I would like to see us do that, maybe not with all grant funds, but Eric Lesser is talking about being able to use municipal revenue to create municipal control of transportation. And I think that if we look at ideas like this, and for every town it would be different because we all have different needs, but if we could create programs like this and find a way to make them sustainable, seniors, disabled people, and economically disadvantaged people could have a way to get transportation and could be safe.
Okay, so John, you're next up. According to the Gerontology Institute at the University of Massachusetts in Boston, 61% of all elderly-only households in Mass are economically insecure, meaning they don't have enough income to cover all of the basic and necessary monthly expenses. Do you feel that the current tax exemptions and deferrals offer enough support to seniors facing financial hardship? And if not, how can we improve them? And are there any programs you'd like to pursue on a legislative level?
Well, they're obviously not working. Most seniors are at a level where they can't afford the basics, you know, electricity, heat, food, and other essentials. So that's a tough question. We have to look at how we can best assist people through programs, both local and state and federal, to supplement folks so that they can meet those basic needs. Again, more and more people are going to be as they grow older, are going to be trying to stay in place in their home, and we have to look at ways that we can make that happen, because in the long run, that's going to be require less from municipalities and state than if they're in some other type of facility. Again, we just have to look at ways in which we can provide those services. There's energy independence programs encouraging solar power. Perhaps that can be a way in which we can push that out, and more people can take advantage of that to reduce their costs. But it's a tough problem that's going to get worse as we grow as a community. So we're just going to have to continue to look at ways that we can provide those services.
And Marie.
They're obviously not working well. And part of the problem is that they are means-tested programs for tax deferral or not having to pay as much on your taxes. And so often somebody lives just above that line and they can get no assistance, but yet they're still not able to survive in their own home. And seniors are wanting to age in place, and who can blame them? I think that we really need to look at not only our property values, but income levels, so that maybe somehow we do a graduated property rate for seniors, as well as one of the things that I would like to look at legislatively, and they've done it in other states. I think Illinois and Wisconsin have tried this. Some cities in some states allow seniors to take a very short defined time loan against their property taxes, so they defer their property taxes for a defined amount of time in order to be able to take care of emergency costs. So let's say they need to put a roof on their home, and they can't do that if they're paying high property taxes. One of the programs allows seniors to repair their homes or to buy emergency medicine. It's a very defined loan. It can't go on forever. You can only do it once. But I think that it's something we need to look at as another way to help seniors age in place. It's really important. And we need to make sure that people can afford to live here, because property taxes are going higher and higher, and people are moving out of the homes that they've loved forever.
Okay, and Dan.
Thank you. Excuse me. Thank you. Obviously a huge issue, and just based on your stats, but also based on our neighbors. We know this is a huge issue. And the fixes that are in place are not adequate. And without a doubt, we need to look at it on a state level and not be afraid to make some changes and to replace some things and to make some new programs. And that will assist not just our seniors, but our cities and towns. I've been exploring property tax rebates and abatements and credits and deferments, and especially in light of the new school project and leading up to the new school project here in East Hampton. And I would go running into the finance director's office with the biggest smile and leave with the biggest frown, because I'd have found a program that the state approves, and if we could adopt it, couldn't we help everybody? And then we'd look at not just the pros and the headlines that I'd found, but all the cons and all the nitty-gritty and all the details. And a lot of those programs have a lot more cons than pros, and a lot of them are just old programs. People are living longer. Some of these programs, you can sign up for them at 65, but they only last 20 years. So if you turn 86, you're sunk, and you owe somebody a lot of money, and they're coming for you. Or if you pass away, your children might all of a sudden owe a lot of money that they didn't know the family owed. And you can really jam people up, which is not what government should be doing, in my opinion. So that's just one example. We talked earlier about some others, and taking what exists and taking the best of what's in there and combining them. So are we using people's assets, or aren't we? Are we looking at age? Are we looking at income? There's so many things to look at, and as we make those laws, we need to look at the big picture and the pros and the cons. Thank you.
All right, this next question is going to Marie. Mental health services are often overlooked in the field of elder care. That is why the Massachusetts Council on Aging has been proactive in securing a state budget for the elder mental health outreach teams. This is a community collaboration that connects PCPs, social workers, public safety departments, home health agencies, housing authorities, and medical centers in coordinating essential services for senior in crisis. Currently, there are only 5 of these specialized units throughout the state, with the exception of Greenfield, and most of them are located in Eastern Mass. Do you feel that this is an important issue to pursue, and would you be willing to support additional state funding for this program?
It's absolutely necessary. A short story, my stepdad, he died August 3rd of 2015, and for 5 years he had cancer, but he was suffering mostly with dementia that was caused due to a stroke. We had so many problems getting him diagnosed because right now it's a very hard field to have people diagnosed, whether it's Alzheimer's or a different kind of dementia, which caused a lot of mental health issues, not only for him, but throughout the family. We absolutely need that kind of program here. I can tell you that the whole time that he was sick, it was really hard to find doctors who knew what we were trying to get at. We weren't trying to take his rights away. We wanted to help him. He was scared. He felt lonely. He was in pain. He didn't understand why. He couldn't remember what was going on from day to day. And yet when he went to a doctor's visit, he could be on for 15 minutes and they thought he was fine. And we would walk away and they'd be like, he's fine, don't worry about him. He's just old. That's not good enough. We need to make sure that we're taking care of our seniors. Mental health is a huge problem throughout our population, but especially when it comes to dementia issues, we need to make sure that we're training doctors better. There is a bill that was actually, they're trying to work on. It's Bill H-1200, which is an act improving treatment for Alzheimer's and dementia. And I think it's really important for that to be part of the program because we have so many people in our population with those issues and we have to take care of it.
Over to Dan.
Thank you. I love the idea of these elder outreach teams, and it's something that we're seeing not just in the senior citizen realm, but throughout community groups. Our local police departments have started DART teams, drug addiction response teams, that they follow up on overdoses, even if there's not a crime committed or someone didn't have to go to the hospital. Well, let's check in on that person and make sure they're all right. I'm proud to be a member of Hampshire HOPE, which is the Heroin and Opioid Prevention and Education Task Force here in Hampshire County. And we had a huge conference in Northampton not too long ago that talked specifically about these interdisciplinary models and bringing everybody together. And the criminal justice system was represented, and so were the healthcare system, and so were senior centers. And we have to bring all these groups together because this is something that affects so many people. That was a huge issue when we first started the drug diversion program, is we had it lined up to help people with addiction issues. And immediately, I was asking every time I called, well, will you also help with mental health issues? Those dual diagnoses are ever present in cases of all ages. That's why I'm so proud that East Hampton's back and our Council of Aging is back with the triad system and that community approach of bringing everybody to the table and working on these things. And so the elder outreach teams that you mentioned to really focus on those mental health services and those crisis services are hugely needed, and I'd be proud to support those on the state level. Thank you.
And John.
Contributing factors to mental health can include health, social interaction, loneliness. We should be making an effort to address those issues so that hopefully they don't progress and develop into more serious mental health issues. Again, we've talked about a good, healthy diet being critical to one's health. Loneliness and social isolation is a big problem. And that exacerbates any issues that one has and often creates new ones. We need to reach out, and this again is where social senior centers are so important, to identify, to reach out, to engage our elders so that they do have positive social interaction on a regular basis. So first, let's do what we can to address some of the critical issues that contribute to that. In South Hadley, we had a couple of professional development days for our town employees to make them aware of mental health and dementia issues within the elder community so that they can be sensitive as people come seeking services, going to town hall to pay their bill, police that are responding to a call when they enter a home, that they're sensitive to and can see potential issues with somebody with mental health or dementia problems. And so let's be proactive up front. Maybe we can slow down some of those developments, and then of course when it finally gets to the point where people need services, then we do need to provide a full range of mental health services, and currently our healthcare system does not do a good job of providing access to those programs.
I'm sorry, did I skip you, Marie? No, okay. Had a moment there. Okay, the next question goes to Dan. In-home services can play a vital role in helping seniors to age in place. However, obtaining the resources to meet this goal can be challenging. For example, a senior may be eligible for personal care services underneath the state home care program. While this is helpful and affordable, the amount of care cannot exceed several hours a week. If an individual should need more than the allotted hours, they'll have to pay privately for care, unless they qualify for certain mass health programs. Many seniors with limited incomes cannot afford the hourly rates that home health agencies charge. How can we support and protect the seniors from this financial burden?
Thank you. I mean, obviously, this is exactly where government can help somebody. We've got these programs that'll help you, but only for this long. And if you need more help, you're on your own. That's not how it should work. The fact that we have this program in place is excellent. The fact that there's the mass health is a component of it that will help is excellent. And what's most excellent about it is that's something that the state can control and can help with. And so that's something that we need to focus on and to continue to support and to continue to expand. Not just because people are stubborn and want to stay at home, but because a lot of times that's the best place for folks to be. And if we can support them and get them the help they need in those situations, then that's what we should be doing. Thank you.
John.
Well, this again gets down to healthcare costs. Providing those services cost money, and you have the issue of home healthcare aides getting a livable wage and making sure that they get paid, adequately to maintain, so that they will stay in those jobs. So again, it's a cost driver. We need to again do what we can to reduce costs so that we have the funds to expand programs that are needed, and we again need to look at this from a community perspective as well. How can we in the community be more engaged with the elders to know what services they need and when they need it, so that things don't progress into a worse case where they need more care. It's a difficult nut to crack. It's easy to say, let's just spend more money and get more healthcare aides on site, but that costs money, and where are you going to get that from the budget? And that's where we've got to really do a lot of work on our healthcare system to reduce costs so that we can afford additional services.
Marie.
Again, I go back to when my stepdad was sick. It's great that Mass Health helps a lot of seniors, but often if seniors are just above that income level, or if they own a home and aren't willing to sign over that home, they can't use Mass Health to help with nursing care. So my stepdad needed care, and my mother, also being a senior, couldn't do it all herself. But they were over that income level between the both of them, but yet they could not afford to pay for nursing care at that hourly rate. They were stuck between a rock and a hard place, and at the time the only solution, because my husband and I were helping take care of him, the only solution was for my 18-year-old son to move into their home and be his nursing care, unpaid. It's really an unfair system, and I don't think that there's an easy answer to it. Definitely healthcare costs are too high, and we need to find a way to control those healthcare costs, but not for the sake of leaving somebody without care. There were too many times that my mother had to change his bedding and flip him over, and she hurt herself doing so. There were too many times that he needed medicines or bandage change or absolute medical care that she could not provide, and nor could my 18-year-old son. We have to find a way to fix it, but I think that it's about controlling healthcare costs. And again, if we go and find out how to go to a single-payer system, I think that we're going to be able to do better for everybody in our population, and especially seniors.
So at this point, we're pulling questions from the audience, and I think this is a good opportunity to have them engage in this conversation. So we move over to Dan, and the first question is, do you support Sonia Chang Diaz's work? Please explain how you believe the education budget formula should be addressed.
Peg's telling me she wants John to start. I'm happy to start if you want me to.
I think you started the last question.
Yeah.
Oh, yeah. Okay. So John.
I'd be happy to.
I'll repeat that.
Oh, yeah. It says, do you support Sonia Chang Diaz's work? Please explain how you believe the education budget formula should be addressed.
Okay. Well, I'm not familiar with Sonia Diaz's work, so I can't really comment on that. I can tell you that we have a built-in inequity with the way in which we fund public education. Right now, it is based on the property tax. So right away, you have inequities between communities with high property values, consider some towns outside of Boston, the 128 corridor, versus small rural communities. It immediately sets a disadvantage to those communities that can't raise the kind of revenue that the wealthier suburban communities can. So we should be moving away from property taxes and to a graduated income tax to more fairly fund education throughout the state. There was a lot of support for the millionaire's tax ballot question. That got knocked down by the Massachusetts Supreme Court, but there's no reason why the legislature can't proceed with a constitutional amendment to implement a graduated income tax to address this funding inequality.
And then Marie.
Sonia Chang Diaz is one of my heroes. She is one of the people in the Senate that has really championed the foundation budget review process. And I've worked with her a number of times because I was on school committee for 4 years. And we would go to advocacy days and sit with her in her office and talk about the foundation formula. The foundation formula was built in like 1993 and was wrong when it started. They forgot to add in medical care and retirement expenses. So we have to go back and really just revamp the entire formula because it's unfairly spread across all of the schools in Massachusetts. There are, schools that are in urban centers that are not getting the money they need. There are definitely schools out here in our rural centers that are not getting what we need. And on top of it, there's the whole piece that there's the foundation budget, which is really the basics, and we can't run a school on that. And many towns can't afford to give a whole lot over that. So in Granby, we give foundation budget plus $300,000 every year, which is literally nothing. And we have to go back to the town every year and ask for almost $1 million just to keep what we have, level funding, and try not to lose any more teachers because we can't afford to. All of our towns in rural Massachusetts are really having a problem with this. We have to make sure we go back, revamp that formula. It's something that I wanted to do forever. I have sat with Alice Peisch, who's the chair of the Education Committee, and I'm really hoping that I can be on that committee to fight for Western Mass because Eastern Mass is fighting us every step of the way. We got to get the money back into our schools and help our kids get educated.
Okay. And Dan.
Thank you. I do support Sonia Chang Diaz and her work, and I was glad, excuse me, years ago when I was on the school committee, she brought her listening tour to Northampton, and we went and told her what we thought and listened to everybody else, and I'm glad she's still fighting that fight. I have been waiting for her to call and yell at me in all these debates when I say they're not doing enough. They're not solving the problem. It's politically popular to talk about it and say it's a problem. And everybody agrees it's a problem. But we need to do more to actually fix it. We need to not just take the plan and the report that's written that has a lot of great ideas, but start implementing them and start putting some money behind it and start backing it up and putting our money where our mouth is. Because it's a huge issue and it's outdated. And one of my biggest problems with it is it was supposed to get reviewed along the way and it never did. And so now it's grown into this even bigger problem that we're faced with, and what are we gonna do? And so what we need to do is continue to change it and update it and review it. We need to fight for Western Mass, where we've got rural needs out here that the Boston schools aren't dealing with. And we need to get creative, and whether that money, some of that money comes from current budgets, or we start actually reimbursing schools for costs we told them the state said they were gonna reimburse us for and they didn't. Whether we rework that millionaire's tax, just because the judge says no, doesn't mean there's not another new creative way to come back and still fight that fight and make that happen. As the chair of the finance committee for the school committee, being on the finance committee on the city council the last few years, I know how important this is, and it's a fight we really need to fight loud. Thank you.
Okay, so this question goes over to Marie. East Hampton has led the state in progressively creating an adult use cannabis ordinance and attracting licensed cannabis establishments. The new businesses bring in additional municipal revenue, develop properties, and employ residents. What are your views on the new local cannabis industry, and how will you support the continued growth and success of our local cannabis industry as a state representative?
I think we need to support it. My only concern has ever been safety. And, for a long time, police officers were saying that they didn't have a breathalyzer. They couldn't find a way to make sure that people shouldn't be driving under the influence. However, they do have field sobriety tests, and that will work with any kind of, any drug that you're ingesting. So for me, if we're going to sell alcohol legally to 21 and over, I don't have a problem with marijuana being sold, and I absolutely think that we should be putting a tax on it and making money from it. We have to find creative and innovative ways to make money in our municipalities. So it's something that we should be able to do. There's also a lot of different ways to use the marijuana plant. So for years, our founding fathers used to grow hemp to build rope and to create all kinds of things and materials that we needed. There's no reason we can't go back to that once we're allowed to grow it. So I support it.
And Dan.
Thank you. I support recreational cannabis. I'm so glad that if it's going to be here in Massachusetts, that as an East Hampton city councilor, East Hampton's decided it's going to be here in East Hampton. And that was one of the most important things to me, was to make sure we maxed out the local property tax, the local sales tax rather, and that our host agreements benefit East Hampton and have some strong incentives for the community and for our finances. I understand there's communities in our district that don't feel that way, and I respect that. But as an East Hampton councilor, going through the budget every year, we need to come up with these new creative ways. And that's something all towns can do. You don't have to all sell cannabis, but come up with creative revenue, I think, is a wonderful thing to do. My issue with legal cannabis has always been public safety and adolescent accessibility. And I fought on the city council to keep our sales shops further away from schools than they are. That's a battle I lost. I still work with the cannabis sales and with the council on these issues. You win some, you lose some. But as an assistant district attorney, I see these cases come in all the time. OUI drugs. And the officers are doing their best, if they think someone's impaired and shouldn't drive, to get them off the road. Even if it's a fight, then maybe I lose in the courtroom because we don't have a way to test someone and how impaired are they. And there's certain things you can do, but we need drug recognition experts, and the state needs to help research and fund those and make sure all our communities can work on those. And then the adolescent accessibility is just something we need to keep a very close eye on, and we saw other states do wrong, where it looks like candy and it's marketed to children, and that's a problem. If it's going to be something adults can use legally, then there's no problem with adults using it legally. Thank you.
John.
This is really not much different than the structure for regulating, controlling alcohol. At the state level, in this case, you have a Cannabis Control Commission that sets guidelines and certain state level regulations on the use of or the retail operations and the cultivation facilities. And then you have on the local level, you have in this case zoning bylaws that each town is creating to put some controls around where these facilities can go, how they can operate. So again, in that case, in this situation, it's very similar to what's being done on the alcohol level. And I don't think this business will need very much encouragement. It's going to grow significantly. Each town in South Hadley, we voted not to allow cultivation, any commercial cultivation or distribution or sales of marijuana. Other towns have voted to to allow it. So each town gets that local control, and each town can do a lot through its bylaws to control the way commercial marijuana is grown, distributed, and dispensed in its community.
Okay, and this is the last question. It goes over to Dan. As you research and prepare for the role and responsibilities of being a state representative, can you give an example of a program/initiative you are aware exists in another Massachusetts district that you say, I would love to create that here, and I can see that program would be amazing here? Please describe the program or initiative and explain why it gets you so excited.
Thank you. I'm going to bring it back to the opioid epidemic, and that's another one that's popular to talk about and politically popular, but it's so important, and it's something we need to make sure doesn't go away, that we don't just say, all right, we talked about it, now let's talk about something else becomes more popular and gets the headlines. This is a real issue that is affecting everyone, and especially today, which is Overdose Awareness Day. It's an issue that I'm going to bring to Boston with me because it affects me personally, and I've lost friends to this, and it affects me professionally, being on the front line the last 2.5 years and seeing folks who have been in my program who have overdosed and are no longer with us. There's so much room for improvement in the recovery community and in the treatment community. And one thing we've done, and we're so lucky in Hampshire County to have a progressive district attorney, he sent me out to Essex County, and we studied their diversion program. And then we took it back here to Hampshire County and started, Hampshire and Frankly, actually, and started that here. And it's not a perfect program. There's so many holes in this system, and as evidenced by the fact that folks in our own program, we've still lost to this problem. But I see huge rooms for improvement in bridging these gaps, and we need to work together as a community and support the folks who are doing the work in the health centers where there's huge turnover rate, and supporting them so that they can support the folks with the substance use disorders, and making sure people have those supports in place, and that we're helping them not just on day one and then wishing them the best, and we'll house you for 10 days and then it's out the door because someone else needs your bed. There's so much room for improvement there, and that's something we should be doing better. Thank you.
John.
Well, what's been clear to me over the past few months is how important it is, one, to get out in the community, and boy, I've been knocking on a lot of doors this summer, listening to people and hearing what the issues are, what their concerns are. Two, it's developing relationships with the other state representatives and state senators, especially here in Western Mass. It is going to be so critical that we work together as a group to press forward with what we feel are the priorities for Western Mass. We can't act individually. The only hope we have of being successful is acting as a group and being a strong advocate for Western Mass. So that requires building a lot of relationships, working closely together, and as a group coming to some consensus as to what our top priorities are. And then it's working and developing relationships among all legislators throughout the Commonwealth. It's really disappointing to see how little got accomplished this past legislative session. We got virtually nothing on healthcare, nothing on education, education reform, financing, and that can't continue. We have serious pressing issues, and we've got to develop working relationships, develop priorities for Western Mass, and then move forward at the State House to get something done.
Okay, and Marie.
I bet y'all can figure out what I'm so animated about, right? Transportation. So coming into this race, I really was focused on education and the foundation budget. But the more I talked to people, the more I realized how much the lack of public transportation in our district is really affecting people. So I'm very excited to really try to work on a system like they have in Greenfield, not just for seniors or disabled people, but for everybody. In Granby, we had one bus route, and it came at 6 in the morning and 2 in the afternoon. And it was like in the center of town. And although Granby seems small, it doesn't seem small if you live on one end of it like I do and had to walk 4 miles to a bus stop. So if I had to use the bus at 6 in the morning, I was going to leave at, 3:30 or 4:30 in the morning on a snowy day and walk to the bus stop. I think not, and most people aren't able to. I just talked to a woman the other day who told me she moved into Granby 3 years ago and bought a house. She likes to rent out rooms because it helps her pay the mortgage. She's had 5 people in the last 2 months that would have been great roommates, but they won't move in because there's no public transportation. It's economic development. It's an inequitable system that we have. PVTA is not working anymore, and I really want to work on a system where we can have something like what Greenfield had, whether it's grants or municipal funds, and have some localized control to help us have better transportation in our towns.
Okay, so now we're heading into closing remarks here from the candidates, and we'll start with John, and I believe we have 3 minutes. 3 minutes.
Okay. Thank you, Brendan. And again, it's great to be here, an opportunity to speak here in East Hampton. And I'd like to also take this moment. I think this is going to be our last candidate forum. I think it's been our 6th. And thank Marie and Dan for what has been really a positive campaign. And win or lose, I'm going to walk away from this knowing that I think we all tried our best, and I think we put our best foot forward. And again, thanks to you guys. I began this evening talking about my professional and municipal government experience and how that has prepared me well for the various issues that challenge us. Now I'd like to talk about something that's going to be equally important in terms of being an effective state representative. And that is the ability to work with others, including other legislators, state and local leaders, and the various stakeholders that are part of any issue that we're going to address. I've been on a lot of boards and committees over the years. I've spent countless hours at meetings and served with dozens of elected and appointed committee members. It is particularly gratifying for me to then have received the endorsement of many of those people who have worked alongside me and who have known me well and know how I work with other members. 7 current and former select board members with whom I served have endorsed me for state representative. From Ira Brzezinski, the current select board chair. John is a public servant in the truest sense of the word, thoughtful, honest, reliable, and hardworking. He has always had the interest of the town's residents as his #1 priority. From Frank DeToma, a former select board chair member. I have served for 7 years alongside John Hine on the South Hadley Select Board. During that time, I have witnessed his excellent judgment, his fine character, his communication skills, and always his willingness to listen and learn. From Mike Tosnick, the former mayor of East Hampton, I worked closely with John as a member of the East Hampton, South Hadley, Granby Regional Veterans District, and I can attest to his dedication and thoughtful leadership on veterans issues. John listens to his constituents and is sensitive to the needs of the community. This is how I work as a municipal official, and this is how I plan to work as your state representative. I will work to reduce healthcare costs. I will work to invest in quality pre-K and kindergarten programs. I will work to develop workforce training programs, to move forward on renewable energy and smart conservation, and to hold pharmaceuticals and distributors accountable for their roles in the opioid crisis. This is what I want to do as your state representative. This is how I will do it. And I ask for your vote on Tuesday, September 4th to allow me to do that. Thank you.
Okay, great.
Thank you again to East Hampton Media and the COA, and thank you, gentlemen, for being great opponents. We have always talked about the fact that we don't oppose each other, we're just running for the same seat. We've been very fortunate in this district to have John Sybeck, who has given 16 years of his life to serve our district and make sure our voices are heard on Beacon Hill. John's been a great role model who has enforced for me that this job is about commitment. A commitment to working with others. A commitment to advocating with integrity and compassion. A commitment to showing up for every town and every citizen in the district. And a commitment to bringing much needed funds back to the Western Mass cities and towns. The issues that I've run my campaign on are very important to me, but they're also very important to the entire district. Healthcare advocacy and single-payer insurance are important to me because I have personal issues that back the need up. But I've also been listening and advocating for Massachusetts people's health concerns for over 20 years on Beacon Hill and in Washington, D.C., with many legislators over the years. Education's important to me because I'm the mom of a special needs son. And I've also been an advocate for other special needs and economically disadvantaged kids and families, both as part of my job and outside of it. Elder services are important to me because I grew up with a mom who was a nurse's aide and a personal care attendant. I volunteered with Council on Aging, and I was a nurse's aide for a very short time myself. I've seen what the struggles are. Food insecurity is personal to me because I have needed assistance in the past. And as someone who works and sits on the executive board of the Neighbors Helping Neighbors food pantry in South Hadley, I see how many people are seeking assistance and what the needs are all around us. And transportation has become an item of much importance in our district as funds and services are cut and people are struggling to get to work, doctor's appointments, and just to have any kind of social life at all. Right now, the political environment can often seem daunting, and many people are afraid of losing income, freedom, and personal rights. If I'm elected as your state representative, I believe it will be my job to make your voices heard, to be a strong ally for people who do not feel that they are treated equally, and to make sure that we don't move backwards, but that we move courageously forward and making our world better. If I'm elected, I'm very aware that it's not only about the votes on Beacon Hill, but a commitment to the everyday work done in collaboration with all of you. On September 4th, I'm asking you to please vote for me to be your state representative. Thank you.
Okay, and Dan.
Thanks again for having us, and East Hampton Media and the Council on Aging, and for everybody for coming out. It's been such an exciting and fun campaign. I told you at the start a little bit about growing up and those skills I learned as a kid. Communication skills, the importance of listening, of collaborating, of working together towards a common goal. And as I've employed those skills throughout my journey, I've picked up new skills along the way. Running the after-school program in Roxbury, working at the middle school in the special education department, running a restaurant, working full-time, running a drug diversion program while putting myself through law school at night, and working as an assistant district attorney, being elected to the school committee on my 29th birthday and chairing the finance subcommittee, being elected to the city council, serving on the finance committee and the public safety committee, and recently being re-elected. I've learned so much through all of those experiences. And I want to bring all of those skills to Boston to fight for the 2nd Hampshire district, to fight for East Hampton and South Hadley and Granby. And I know how important this job is. And we've been lucky that we've been so well represented, not just in the 2nd Hampshire district, but in Western Mass. John Sybeck and Ellen Story and Stan Rosenberg and Peter Kokot and Steve Kulik did such a great job. And that's what makes this election so critical. We're losing all that experience, all that political clout and earned seniority in Boston. We need to elect a new, fresh, energized, excited representative who's going to take their skills in Western Massachusetts and listen to the constituents of these 4 towns and fight for these people in Boston. Western Mass is so underrepresented in Boston. We have to be fighting night and day so that we're heard out here and our needs are met out here. And I just want to mention the 5th state rep who inspires and motivates me throughout my life and especially throughout this campaign, and that's my grandfather, William Carey. He was state representative for the 2nd Hampshire District from 1974 to 1986. And it's been such a huge inspiration to me every single day, especially when we talk about constituent services, knocking on doors and hearing stories from folks in all across the district about the time he helped me with this, the time he helped me with that. The stories I hear about Grandpa are always, what a hardworking rep, what an honest rep, what a man of integrity. And that's the type of rep I plan to be. So I ask you for your support and I ask you for your vote the day after Labor Day. Don't forget, Tuesday, September 4th. Thank you very much.
Thank you. Let's give them all a round of a hand. So thank you very much. I appreciate the thoughtful answers and some of the great questions Brendan came up with. I'm happy to be standing up here and not sitting down there. Also wanted to mention to the folks here and to the folks watching that City Hall will be open Friday to take your votes if you are not going to be around next week. So if you will be on vacation, please get into City Hall this week, Friday.
Until 5 p.m. on Friday.
Until 5 p.m. And to Dan's point, Tuesday is Election Day, day after Labor Day. So let's all turn out because it's really, really important for this district to have good representation. So again, thank you for being here. Really appreciate it. And thank you again to the candidates. What a great turnout. Appreciate it.